I am honored to introduce the presidential address this year, as I am a mentee of Dr. Vino Thurani. A lot of you in the room know him well, but those who do not, here are some slides about the current president of our society. So let's start with a more personal story, the day I met Vino. I was heading to the STS 2014 for the meeting and to explore my options regarding a fellowship in structural heart, as I was a PGY5 in the cardiac surgery program at the University of Montreal in Canada. I already had an idea where I wanted to go, but that idea changed when I started to notice this surgeon that was giving a lot of talks at the TechCon session and other transcatheter valve sessions. At that time, it seems clear to me that this surgeon would be one of the leaders in that field and that it would define the path for other surgeons to do so. I waited for him at the end of the session, and after approximately 20 minutes, because of course 10 other people went to talk to him, I introduced myself. Vino was really nice and asked me to send him my CV. What I immediately did, and a few months later, I flew to Atlanta for an interview with the team and got accepted in the Super Fellow Structural Program for surgeons under his supervision and spent 2 amazing years. I came back and was the first officially trained cardiac surgeon in structural heart procedure in Canada. Vino paved the way not only in the US, but in many other parts of the world, and we are doing the same in our own countries now. So, who's Vino? Dr. Thurani is the Bernie Marcus Chairman of the Department of Cardiovascular Surgery at the Piedmont Healthcare and at the Marcus Heart and Vascular and Valve Center of the PHY in Atlanta, Georgia. He's also the Surgical Director of the PHY Structural Center of Excellence. Vino has a very busy clinical practice as he's doing more than 450 cases per year. Vino, throughout the years, has demonstrated beyond leadership qualities and skills. His determination to make positive changes has led him to be asked to serve on different board of directors and executive committee of different societies, to be chair of the National STS-ACC National TVT Database and STS Adult Cardiac Surgery Database, to be on the editorial board of our major cardiac surgery and structural heart journals, and he has been elected president of 4 different societies, and he is our current president. Despite his busy schedule, Dr. Thurani has a very productive academic career, having published more than 700 peer-reviewed articles and 20 book chapters, having done more than 500 presentations, being the PI, co-PI of 10 valve trials, and having raised more than $6 million from industry and federal funding for academic achievements. Vino, doing this next slide, I felt like if I was in elementary school, but here's how I perceive Vino, and those are, I think, important qualities for us being in that field. A visionary, an innovator, a nurturer, and this is not only a maternal term, but also related to leadership, an outstanding clinician scientist, and an amazing dad. Also, if we continue with the letters things, in keeping true to his initials, working by Vino's side could give you VTAC. First, by trying to walk as fast as him, but also by keeping his pace on clinical duties, meetings, conference calls, research ideas, academic work, and more. Because of his intensity, Vino would probably also hold records for the number of presentations given, as mentioned previously with more than 500, of Zoom meetings and conference calls, and of the number of years he spent as a resident, 11 years. To the eye of our community, Vino is also the valve guy. He envisioned with his mentors that the field was changing towards minimally invasive and transcatheter approach, and that the involvement of cardiac surgeon was necessary. During his practice, Vino left for China and Germany to get this specific training. And at the end of the day, what is important for Vino is to provide personalized, exemplary care for giving patients the option for new innovative technology that are relevant to their diagnosis, and approaching them with traditional, minimally invasive, or transcatheter procedure. Vino is also absolutely thankful for all the mentors he had during his career, all also leaders in our field. And that is why he's now mentoring others, and not just only during the fellowship period, but also after, keeping in touch with all of us and giving us opportunities to rise and shine. We kept that feeling, though, that we need to perform at Vino's standards, as the bar is quite high to one day maybe surpass the master. Vino is also a great friend that we can rely on, and I did not have enough room to put the picture of all his friends currently here because there are way too many. Vino, I surveyed some of our common friends, mentees, and colleagues about you and put some of their words here. Those words reflect on what many people think of you. So, for example, James, it was a pleasure to work with one of the true pioneers of interventional surgery. He taught me how to do it all, balance a busy surgical practice, an active research interest, and be a great husband and dad. Amy said, Vino is the epitome of fortitude. His staunch dedication to innovation and clinical research has propelled cardiothoracic surgery and transcatheter valve therapy to unprecedented heights. Tom, people know him as an incredible surgeon, researcher, and leader, but what I value the most is his extreme mentorship. Brad, although Vino is well recognized as an innovator with respect to minimally invasive transcatheter heart valve technology, he is a true surgeon, not shying away from the tough, open, reoperative, complex cardiac cases when what is needed. And Talal, Vino has been a generous mentor to countless surgeons such as myself. Our careers and, more importantly, our patients benefit on a daily basis from this mentorship. So Vino, where do you get all this from other than your mentors and your training? Probably your family. Apart from being a doctor treating cardiovascular disease like his dad, Vino followed in his dad's footprints as he is sharing his values. How do I know that? Vino, we are Facebook friends, and I feel right now like a stalker. But I saw once a message that your dad posted reflecting on his dad, and he wrote, "He taught me honesty, integrity, hard work, ethics, and human values. Also, my dad was a loving father." Those same values will probably be transmitted from generation to generation, hence to your 4 beautiful sons. Because yes, despite all this busy schedule, Vino is a family man. He's a loving husband to his wonderful wife, Marissa, who leads the Turani family, and he's the father of 4 boys. Vino does not like to be bored, and despite the intensity of his careers, during his free time, he's actually looking for adventures, adrenaline, and likes to travel. He also likes to dress in really nice costumes. To summarize my dissertation about you, Vino, I think that you're a model for the next generation of surgeons. What I think personally is one of your biggest contributions is that you have proven that surgeons and cardiologists can work seamlessly together as a heart team, that barriers that once exist can be torn down to lead to a team collaboration that produces exemplary care for patients. And from my personal experience, Vino, the thing that you taught us, the attitude to have, our mentality and our clinical expertise, made the point that we can be part of the art team and to have very functional and harmonious art team. Vino taught us to be careful not to get lost in the technology, but to ensure that we concentrate on the highest level for quality patient care that we can provide. And this can be on a local level at the hospital, but also on a national level with our respective societies. Also, you are a real leader that includes the quality to nurture, which means true and great leaders find satisfaction not only in teaching others, but also in nurturing them and showing others how they can become more than they ever believed they could. So on behalf of the entire society, Vino, we would like to thank you for being you and for advancing the field of minimally invasive surgery. Your presidency will definitely be remembered. Thank you. So, without further ado, let's hear about your presidential address, which is entitled "Defining the Limits of Sanity, the Best We Can Be for Our Patients."
That's going to be a hard one to follow. Jessica, that was spectacular, and thank you very much. I've been blessed to have some phenomenal people that I've worked with. I don't consider them my mentors. They've now become my colleagues. I'm very indebted to them. I thought today, these are my disclosures, by the way. I think from the beginning, my family has been the most important thing. This is the family that God gave me, that I didn't get to choose, but they chose me. And this represents all of us. I have 3 older siblings, and of course my mom and my dad have passed away, but are there. And then the family to my right is the one that I acquired through Marissa. But these are the loves of my life. I love them dearly, my 4 sons. And on the bottom right, actually, I had dinner with my son and his girlfriend last night. And these are 3 of them. And the 4th one just recently came, and this was just this past Sunday is my youngest, my 2-year-old. And so, and he's, you know, when I come home, that's the first thing we do. He hops on my shoulders, and we go upstairs, and we change out of my scrubs, and it's just the beautiful part of my day. So these are really the 4 loves that I have. One's a junior in Indiana, one's a freshman, soon to be in University of Colorado, and one is a 1st grader, soon to be, and then the other one's going to preschool. So I have 4 guys who has spanned 18 years. But of course, the glue, and Jessica mentioned, the glue of my life and keeps our family together is Marissa, and she is a diehard Georgia fan. But and unfortunately couldn't be here because we were traveling, and our nanny is going to be available tomorrow, so she'll be here tomorrow with some of the boys. So it really remains the glue. Jessica did mention some of my mentors, and I am absolutely indebted to these 4 gentlemen who have created, in addition to my father, of course, my academic mentor is David Feliciano, who's a trauma surgeon that most of you in the room may not know. But the other 3 you do know, but these are the ones who really instilled my drive into patient care and quality that I so dear for. And this is my work family, and it transcends people who were with me in DC, those who were with me in Atlanta when I was at Emory, and then those who also with me when I was in Washington, DC. And this is where I'm at now. It's the Heart Institute at Piedmont. It's one of 18 hospitals, and this is the largest of the hospitals in where I currently practice. And these are my partners. There are the partners over 3 or 4 hospitals, and of course, Kim, who's now spending a year with us from January to December, just like Jessica and Tom and Talal and others have spent. And this is what I call the dream team. It's our cardiologists who I work with, and there is no separation. We're absolutely a seamless team that work on everything together. So I'm really indebted to that whole thing. But what you thought I would talk about is research. And these are the trials that I'm currently doing at our hospital. It's a lot. It's a lot of valve trials that we're doing. And I thought you probably thought this is what I was going to talk about. And you probably thought I was going to talk about the 9,000 patients we've randomized in this entire pathway. It's not just about TAVR, it's about disease management. And I think that's important for you to remember. I'm not a TAVR surgeon, I'm not an open surgeon, I'm a disease specialist. And we have to rethink a way that we talk about that. You might have thought that I was going to talk about mitral valve transcatheter technology, right? I mean, that's what I'm doing now. I do a lot of this, and I do a lot of open, I do a lot of minimally invasive, I do a lot of transcatheter. I think innovation is important. I think that innovation to me is equal to survival. And I learned this in 2005 when I started practice. In 2006, I went to China and Germany, and Fred Moore was so kind enough to have me, and Fuai Hospital was kind enough to have me. But at that moment, my first year as an attending, I thought of innovation. Cardiac surgery will survive, but cardiac surgeons who do not participate in innovation will not survive. Maybe that's why you're here. This is an innovation. A lot of what we're talking about is not, I did my 1,000th thoracoabdominal. No, it's new ways of doing that. You have to become an agent of innovation. If you don't, you will develop, you have to be leaders of this for trials. I think this is really important. You have to own it, and you have to lead it. And also referrals eventually will shift to surgeons who are participating in innovation, as they will be viewed as a state-of-the-art practitioner. So we've heard a lot of that last night. We also heard it today. But you have to remain patient-centered. You have to evaluate and reevaluate new technology. You have to focus on the new procedures. You have to find where is that unmet need for surgery. And you have to allow for some compromise in these high-risk patients and extreme risk, but always be mindful for this. This is a quotation or some descriptions from Bill George, who was the past CEO of Medtronic. Define your values, because leaders are created during innovation. I look around the room and I think of so many innovation that people have led. Tom Nguyen, Vinay Badwar, Bob Kiai, the list goes on and on, Manny, there's Dr. Fonger. I mean, there's just a lot of people who have become leaders through their innovation. You have to find the sweet spot of your motivated capabilities. You have to build a support team. You can't be a team that everybody's scared of. You have to build a team that has equal, safe space to talk in. And you have to make the journal from I to we. If you don't do that, you'll be great, but they'll forget you. It's about the we, not about the I. Cultivate self-awareness and become a global leader. We're not going to talk about all of these new technologies. I've decided that that's something that you'll hear about in the next 2.5 days. Jessica, Eric, and others have put together a phenomenal program for you. But what we're going to talk about over my last 18 years of my practice is that we cannot be effective innovators and surgeons unless we take care of our own mind. So this is a book I've recently read. It's called The Book of Joy. In April 2015, the Archbishop and the Dalai Lama met in Dharamsala, India, to celebrate the Holiness's 80th birthday. And they wanted to create a gift for all of us. I bet you most of you in this audience have never heard of this book. So I'm allowing this for you to participate into their book. And they offer us 8 pillars of joy, which provide the foundation for lasting happiness. And Orly, don't worry, I'm not going to go through all of those because we'll be here till tomorrow discussing them. Mental immunity. I want you to think about that for a little one. Everyone knows that physical pain is bad. We've talked about it. We talked about ERAS. I've already seen so many slides about how to get rid of physical pain. We do this by curing diseases. We do this for our patients by preventing it. Right? We do this by keeping our own physical immunity strong. I take a little tablet in the morning when I travel to keep my immune system going. But mental pain is equally bad, so we need to find ways to alleviate it. And the way to do this is develop mental immunity. And I would bet that most people in this room have never heard of mental immunity. It's just learning to avoid the destructive emotions and to develop positive ones. It's about filling your mind and your heart with positive thoughts and feelings. I get asked a lot, you do a lot of stuff, you're on conference calls, you're in the OR. Rarely do you see me angry, and rarely do you see me upset. Kim was with me now for the last 5 months, and she's actually said that to me before. I think that it is a psychological theory that's also known as cognitive immunology. And this dates back almost 70 years ago. The field of research is based on the premise that not only is there an immune system for the body, but there's also an immune system for the mind as well. You can see on the right how cluttered on that graph of the brain, the right is so cluttered, the left is not so cluttered. So mental immunity equals mental wellness, which equals, in my mind, innovation. If your mind is not clear, you won't be able to innovate. And that's what really ties it to us as cardiac surgeons. I think this is really important. So there are obstacles of joy. I'm not going to go through all of these because we'll literally be here till tomorrow. I wanted to concentrate on this one, envy. For this group specifically, envy. Envy towards those above you, those that are higher than you as far as academically. Competitiveness towards those equal to you, and content towards those lower to you. So upward comparisons are particularly corrosive to our well-being. Envy does not leave room for joy. I think that's a very important comment. The Tibetan word for envy is trakadak, which means heavy and constricted shoulders. Think about that. When you're envious, you have a lot on your shoulders. You can't think clearly because you're thinking about how someone else is doing. Envy is so corrosive that it compares it to a venomous snake that poisons us, as per the Dalai Lama. And here you can see, here are some remedies from the Archbishop. Gratitude. Be thankful for the stuff you have. I have to teach this to my 7-year-old all the time. He wanted a new iPad. He wanted to give his old iPad to his younger 2-year-old brother who doesn't know anybody, but doesn't know any better. I'm like, come on, Connor, you can't do that. Be happy with what you have. You already have an iPad that's 2 years old. 2 years old, why do you want a new one? It's just being thankful for what you have. Motivation to improve our situation is certainly better than envy of someone else's. I think that's really important for you to think about. And reframing, not how are we, but how are you? And someone else's achievements or happiness is in a very real way our own. I want everyone for the next 10 seconds to think about who you envy. Now, throughout this meeting, I want you to work on what you have is actually really wonderful, and how you plan to change your envy to something positive. Don't think about what other people have, but what you have. Not if your brother has the ice cream and you don't. Why is that? Think about that over the next couple of days while you're in this meeting. What I want to spend most of the talk is on what are the 8 pillars of joy. I think about this a lot. Part of my day every day is to think about this. The top 4 are qualities of your mind. The bottom 4 are qualities of your heart. We're again not going to go through all 8 of these, but I've specifically chosen a couple for us to talk about. This one, let's talk about perspective. A healthy perspective really is the foundation of joy and happiness. This way we see the world is the way we experience the world. Changing the way we see the world, in turn, changes the way we feel and the way we act. Under a wider and larger perspective, you should be able to step back, look at the bigger picture, and move beyond your limited self-awareness and self-interest. And I think that's really important. These new perspectives will undoubtedly lead to serenity, equanimity. It does not mean that we don't have to have the strength to confront a problem. I'm dealing with problems every day. And all of us in leadership positions are. But we can confront it with a creativity and compassion rather than rigidity and reactivity. And I think in our field, we do a lot more reactivity than we go back and think about how to do it constructively. If you look at this little guy here, he thinks that there are 4 pillars there. But look at the other guy. He sees 3. If you move your eyeballs to the person on the left, he sees 4. Move your eyeballs to the person on the right, he sees 3. And it kind of freaked me out. I had to look at this 10 or 15 times to really get it. If you look at this guy, he sees 6. What does this guy see? 9. And on the bottom, the person on land is looking at the boat going, oh my God, there's a boat. And the guy on the boat goes, oh my God, there's land. There's different ways to look at it. There is no right and there is no wrong. I think this is important for us to think about. During the meeting this weekend, I want you to spend some time and some mental energy in the ways of solutions to work for you. Create an environment that supports perspective sharing and effective communication among our team members. I had to do this last week. I had complete disarray amongst our APPs and our physicians. And we sat in a room, and the first things I said to everybody, there were about 10 people in the room, I said, we have now created a safe space. Everybody is equal. We need to just feel out how we're going to say this. And everybody came out at the end. Some people started tearing up. And we now are a better team for this. It actually was a team about the cardiologists, not even about the surgeons. And I think we have to rethink of how we do this. A multidisciplinary team really brings together a variety of people. We're no longer just about surgeons. We're about a team. This works best when the teams communicate effectively and integrate their diverse perspectives. This is a tough one for me. I've only shown this presentation to one person. And they said, really, you're going to talk about humility? I think it's really important. It's defined by the Latin word humus, which is earth or soil. And the Dalai Lama said, when I give a talk, I consider myself as simply another person, just as those in the audience. Same human being with the same potential for constructive emotions and destructive emotions. And I've had both of those in my 18 years of practice. When we meet anyone, we must remember that they too have this same desire to have a happy day, a happy month, and happy life. When I say hi to Bob today, I'm thinking he wants to have the same great day that I'm having, and that's very important. None of us are immune to pride or ego. Everybody in this room has pride and ego, some more than others. But true arrogance really comes from insecurity, and I can tell you, in my first couple years of my practice, it was purely insecurity. And you have to, in order to become an effective leader, you have to grow out of that. And I think this type of talk is very timely in where we are in the world right now. Needing to feel that we are bigger than others comes from a nagging fear that we are actually smaller. And I can tell you, early in my career, it was that way for me. Learn to laugh at yourself. I laugh more at myself, usually in my car driving home, but I love, and you have to learn to laugh at yourself also. You have to make a transition. In my opinion, to be an effective leader, you have to move from arrogance to humility. Don't be scared to say, I was wrong. My idea is good, but yours is a lot better. You have to go away from the fault proof that doesn't listen, that interrupts, wants to be right, to admits mistakes, listens to understand, gives space, has an open mind. This is a really important pathway for someone to move to the next level. You have to go from knowledge, hardworking, sincere humility. That leads to success. Ego, jealousy, cheat, laziness leads to failure. And you really have to have empathy and humility, and you have to listen, and then you have to recycle that over and over and over again. If we go to qualities of the heart, gratitude, it means move from counting your burdens to counting your blessings. And I've heard so many people say, I don't have this, but I always say, it's okay. If you're grateful, you're enjoying the differences between me and respectful to all people. Gratitude connects all of us. It connects me to Jessica, it connects me to Tom, to Brad, it connects me to everybody. It cuts across the default that our brains are in a negative bias. Generally, our brains are in a negative bias, and it cuts through that. It allows us to see what is good and right, not just what is bad and wrong. Just the simple act of smiling for 20 seconds a day actually can trigger positive emotions and starting joy and happiness. And it's a factor that seems to influence happiness along with our ability to reframe it. We can't be in Boston without quoting John F. Kennedy. As we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. And we have to hold ourselves to that standard. Even in the chaos of everyday life, moments of gratitude remind us to hold on to the good things. And 4 ways to do this: focus on people, not performance. Focus on people, not buildings. Customize your Thanksgiving. Be specific in your gratitude, and don't fake it. People can see the fake. Compassion. Too much self-centered thinking is a source of suffering. We're in a profession that makes it hard for us to compassion for ourselves. Very little do we do the kumbaya, and most people who know me know that I'm not a kumbaya person. But we need to spend so much of our lives climbing this pyramid. I've done it. Everybody in this room has done it. We're climbing this pyramid to constantly be evaluated and judged. People don't rest when they're tired and neglect their basic needs. And people feel anxious and depressed because they expect themselves to have more, be more, achieve more. But I'm here to tell you that you can do that and still keep a mental immunity for yourself. One of the things that's drawn me to ISMICS is this. There's a compassion not only for me in Atlanta, but also in Sacramento, in New York, where Nirav is, to Montreal, where Jessica is, around the world, to our friends in Germany and Italy and the UK. We in ISMICS is one of the few organizations where in our last sessions, half of our board is European, half of the board is American or North American. It's something that we can do across the world, and it doesn't just need to be with your team. This compassion can lead across the globe. This is a quotation from Dr. Shafik. In the past, jobs were about muscles. Now, they're about brains. But in the future, they'll be about the heart. So these are the summary of the 8 pillars of joy that I think we should all think about, all the way from humility, all the way down to generosity. And we didn't cover all of them. And I encourage you to read this book by the Dalai Lama and Desmond Tutu. I think it is unbelievably insightful. Where I want to talk just a little bit about the boosting your immune system, and I'll end with self-awareness. How can you boost your psychological immune system? One is to get regular exercise, even if it's 20 to 30 minutes a day. I know it's tough, but we do it. I was at the gym this morning at about 5:45, and it was packed. I don't know that many of them were surgeons, but it was full. And I think just doing 25 minutes, which is all the time that I had, is very important. Regular exercise helps reduce stress and anxiety. Even just a short walk. Sleeping. I think this is really, I sleep 7 hours every night. And that, except when I'm on call for dissections, which seems to be every time I'm on call, I get a dissection, but take out that night of a dissection, I will sleep at 7 o'clock, 7 hours every night. I think that's important for me to be able to function at the top of my game for the next 15 hours, 16 hours. I would take some time for self-reflection. That's something I try to do every night before I go to bed. It's just have moments of self-reflection. I think that's really important. Having goals and motivation actually is a very powerful stimulant for the immune system. So don't just go to the day, throughout the day, just randomly. Have goals and motivations. I want to end the next 5 minutes with self-awareness. This is a book that is actually really good. It's called Dare to Lead. It's by Brené Brown, who's from the University of Texas in Houston. I think this is a huge problem for us in a specialty. Self-awareness. I think everybody thinks that they know themselves, but I'm not sure you do. I can tell you that only in the last 5 or 6 years have I really had great self-awareness. I can tell you the first 10 years of my career, I don't think I had good self-awareness. And I'm proud to say that. I don't think I didn't self-aware myself very well. When you lack self-awareness as a leader and an innovator, when you're not connected with the intentions driving your thoughts, feelings, and actions, you limit your perspective and insights on how to become an effective physician leader and an innovator. I think this is really important for you to think about. There are 5 signs of lack of self-awareness. And you may think that this isn't you, but I'm willing to guarantee you there are a lot of people in this room who actually lack self-awareness. You're constantly defensive. You're constantly micromanaging. You constantly bully people. You constantly make excuses, and you're not aware of your emotions. I'm willing to bet, if you really think about this, there are a lot of people in this room that feel this way. And we need to really think hard about this. There are 5 components of self-awareness. Identifying emotions. I'm not talking about stop doing big surgeries. When I talk to Brad sometimes, I call him up, I'm like, what'd you do? He goes, oh man, I did a redo bend tall, and man, that was a tough case. That's okay. He's not whining to me. He's just telling me he had a tough day. But understand yourself. Appreciate self-perception. Recognize your strengths. I don't have all the strengths that I need to have to be what I want to be. But maybe I have 70% of the strengths that I want to have, but realize what those are for you. Possessing strong self-confidence and displaying self-efficacy. And there are ways to improve your self-awareness. Ask for feedback. I do that. 54 years of age, I still ask for people to give me feedback. I want to know. And I'll say to my team after I send it, does that make sense? Did that work? Did I do that wrong? And I'm always judging myself on how I can do it better. Recognize your strengths and weaknesses. I think self-reflection is more important than you think it is. And at nighttime before you go to bed, Just self-reflect. I actually do it for 3 minutes, and I've got my 7-year-old. This has not worked. This experiment's been a failure. Connor sits down with me to self-reflect for 3 minutes, and he can't sit down for 3 minutes. And so he's jumping on me. I'm like, Connor, I'm not talking to you. And I'm sitting there, and he's jumping on me, making funny faces at me. He's thrown stuff at me. And I said, Connor, I'm not going to respond to you just throwing something at me. So self-reflection with a 7-year-old is a failure, but I keep making him do it. Monitor your self-talk. Practice saying no. That is very difficult for me. That's probably my biggest fault. I don't say no, and I'm learning to do that more and more. Tom asked me to come to Vietnam. I said no to you, Tom. I want you to know that. That's part of my self-awareness, that I sometimes don't say no. Why? Because I'm going to be with my family at Lake Oconee, and I decided that for this time period was better for me. So as I kind of end this, ISMICS is a phenomenal organization. I've been absolutely just blown away that I've been given this opportunity for the last 12 months, to be able to be a part of the inner circle of ISMICS. It is built on the premise of innovation, of forward-thinking surgeons who will always remain on the leading cusp of our profession. The other societies weren't even talking ever about robotics. Guess where it was really mainstay? ISMICS. TAVRs, transcatheter technology. Guess where it was? 5-7 years before it was ever in the bigger societies or different, it was at ISMICS. However, to maintain this innovative spirit, we have to work harder than everyone. We have to innovate more than everyone. We have to investigate more than everyone. We have to really look at our own self and say, is that what procedure we just did the right thing to do? But we also need to find the time for mental fortitude by realizing perspective, humility, gratitude, compassion, self-reflection, and self-awareness. If we don't do that, we can't innovate. This is my last slide. This is from a Mayo Clinic surgeon, John Stulak. Some of you may know this. Why do we innovate? Do we do it for glory? Why do we do these cases that are harder for us sometimes? No, we do it for our patients. If you do it for your patients, which is what all of us really should strive for, then I think this poem that was written by John it blew me away. This is a surgeon, you, me, talking to a patient. I don't know you, but I will lose sleep for you. I will miss my family time for you. I will forgo meals for you. I will wear down my body for you. I will cancel my personal plans for you. I will worry about you. I will feel your pain. I will emphasize with everything you are feeling. I don't know you, but I love you. Thank you very much.